Welcome to page 61 of Anatomy Coloring Book, Muscles of the Medial Thigh. This is Dr. Stephen Harkins. First, let's get the Obturator externus out of the way. It's a little muscle that we've already talked about with the lateral rotators, but because its origin is here on the front of the obturator frame, and remember we had difficulty diagramming that because it was unseen from the back, and because it lies sort of in the adductor group. There's some controversy as whether or not it adducts or pulls into the midline, but it's innervated by the same nerve as these adductors, so it's here in this group as well. And so, as you know, it's an external rotator and probably an adductor as well. That's obturator externus. Now, the pectineus muscle is a muscle of the medial thigh, and it is an adductor as well. It will bring the leg inward, and it lies right here. And you can see its origin right here on the superior pubic ramus, and then it inserts right here on the medial the medial shaft of the femur. And obviously you see if it attaches from here to here, origin to insertion, it is going to adduct the femur or bring it towards the midline. And here is an example of adductors and the space they occupy here, and how they would be important in riding a horse because they bring the femurs inward. They would be able to squeeze the horse inward into adduction. Next up is the adductor brevis. The adductor brevis. Adductor brevis is this little muscle here sneaking in here. It has an origin right here at the inferior pubic ramus, and an insertion right here at below at the anterior medial shaft of the femur. So it's been cut off here and here. And so you can tell if this muscle were to pull, like the pectineus, it would adduct the femur and bring it closer to the midline. And while we're here, why don't we take one step back and color over here the pectineus muscle as we move along. And here as well, the pectineus, which is cut away. Next is the adductor longus. The adductor longus, this muscle right in here. And after these muscles are cut away, after the sartorius and the quad muscles are cut away, you can see its origination here on the pubic bone here, and its path, which courses down to the anterior medial femur here. Obviously, like the pectineus and the adductor brevis, the adductor longus will do what action? It goes from here to here. It's going to bring the femur inward into adduction. And here it is cut away to show the deeper underneath muscles. Now, moving along, the adductor magnus. Magnus means big. So here we have the adductor magnus, a very, very large and powerful adductor muscle. It occupies all of this space of this musculature here. You can see why they call it the magnus. Because it is a massive muscle. And here it is over here. And it's got a big tendon, long tendon on it. And you can see how it reaches from this inferior pubic ramus here to the anterior medial femur. Notice this little gap or this little hole right here in the middle of the adductor magnus. This is a little hiatus or a hole for the femoral artery and the femoral vein to pass through. And the last of the muscles of the medial thigh is another adductor of the thigh called the gracilis muscle, and it lies right here on the medial side of the thigh, the most medial of all. And it's got this big long tendon that comes down and attaches at the pes anserinus, which we talked about previously, because that is also the insertion, if you recall, of the semitendinosus muscle, which wraps around from the posterior and inserts along with the gracilis muscle here. Here's another look at the gracilis muscle on the medial thigh, wrapping around to the pes anserinus, that area of the medial tibia right here. The medial tibia, here's the gracilis muscle again, and the insertion right down into the pes anserinus of the medial tibia. Obviously, you can see by its action that it is going to adduct the femur as well, or bring it inward. And here it is again. So you have your origin of the gracilis right here at the inferior pubic ramus, and then the insertion down here at the pes anserinus. So the path would be something like this. And of course, if you bring your leg out this way, the gracilis will help bring it back in with adduction. While we're here, here's another good look at the iliotibial tract, that band of tissue, of connective tissue, tendinous, strong, tough, stretchy band, which extends from the tensor fascia lata muscle. And then the gluteus maximus also inserts onto this band as well. This is the rectus femoris muscle, which we'll be learning about. Here's the sartorius muscle, the vastus medialis, and the vastus lateralis, the muscles of the quadriceps, all inserting into the patellar tendon. Here's the patella. And we'll talk more about that in the next lesson. One major correction here, actually, is that the insertion of all of these adductor muscles is actually on the posterior. It's on the back of the thigh, and that's why they were in dots, sort of stippled and dots to show that they actually originate on the front of the pelvis, the front of the pubic and ischial bones, and then they travel to the back, the posterior of the thigh along the linea aspera. I apologize for that. They do not insert on the anterior medial portion of the femur. They insert on the posterior linea aspera, the line on the back of the femur. It is described right here. Here's the linea aspera line on the back of the femur, and you can see the connections from the pectineus, the abductor brevis, the adductor longus, and the adductor magnus. And of course, your hiatus, your adductor hiatus. And lastly, note how the more vertical running fibers of the adductor magnus actually wind up less lateral and more vertically running, because it's a fan-shaped muscle. It fans out from the pelvis laterally to the linea aspera of the posterior thigh, and the muscle's so long and so vertical that it winds up attaching down here at what's called the adductor tubercle on the posterior surface. The adductor tubercle here, right back here. So the muscle has its origin on the pelvis, but then fans out to the linea aspera and then the adductor tubercle on the posterior surface of the femur. Note that the gracilis muscle, which is cut here and here, attaches at the pes and serinus. And when the knee is bent or flexed, if you'll notice right here in yellow, imagine flexing this knee. This gracilis muscle actually becomes a knee flexor along with the hamstrings because of its position here attaching to the tibia. It can in fact act as a flexor along with the hamstrings. And this ends the lecture, page 61, Anatomy Coloring Book. This is Dr. Stephen Harkins.